Okay, team, let's continue our discussion today with acid-base disorders. So, what I really want you guys to get out of today's lectures and what the majority of your questions are going to be based off of are these three big things. One, the body's normal regulation of pH. We're going to talk about exactly how our body maintains normal pH under different systems. And these would be the buffering system, the respiratory system, and using the renal system. This is important because whenever we do have any kind of disturbances in pH, this helps us talk about what the compensatory mechanisms are. Also, I want you guys to be able to interpret ABG. So what you guys are going to have to be able to do is tell me if it's an acidosis or an alkalosis or if it's respiratory or metabolic. And then finally, I want you guys to be able to diagnose and treat metabolic acidosis and alkaloses. You will have to interpret the ABGs for respiratory diseases, but usually the treatment of those respiratory diseases involve more of a respiratory therapy approach than a pharmacological approach, so we're not going to talk about those as much. However, metabolic acidosis and alkalosis, we will talk more about. And whenever I say diagnosis, I want you guys to be able to identify some of the underlying etiologies. That includes calculating a serum anion gap, so an SAG, being able to identify patients' renal tubular acidosis and how to treat them, and then also how to treat and identify metabolic alkalosis. So here are some ground rules. You can either listen to the lecture or read the module. There are no dosing questions. As mentioned before, the holiday secret and osmolality is provided in your equation sheets, so you do not have to worry about memorizing those. Your reference ranges are given on exams. We'll talk about fishbone forms this time. All other than pH, the rest of the fishbone forms will not be testable material. Your questions are going to be based off the objectives, and I'm going to make sure that we have a case discussion in class. So since we do that, then the majority of your questions will be case-based.